adjustable Therasnore is a boil and fit appliance that is made of a thermoplastic material supported by a hard polycarbonate frame. The adjustable Therasnore appliance is made of an upper and lower tray that snap and lock together. The top portion of the appliance can easily be identified by the arrow in the center of the front, which points up. In the center of the lower portion, the appliance has a vertical protrusion that will prevent the mandible from retruding. On the inside surfaces of both parts are 4 snap-together points, which resemble railroad tracks. When correctly fitted, the adjustable Therasnore is designed to allow the doctor to initially position the jaw in a normal bite relationship. The adjustable Therasnore can, however, be moved forward in precise 1.5 millimeter increments to position the mandible from slightly protruded to as protrusive as 7.5 millimeters. A position indicator is located on each side of the appliance, labial to the posterior locking mechanism. On the upper tray, this indicator consists of the numbers 1 through 5, with number 1 being the most posterior. On the lower tray, there is a small arrow, which can be positioned to point at a specific number. To fit the adjustable Therasnore appliance, you will need the following equipment: a microwave oven, or a container of water which is at least 160 degrees Fahrenheit, and either a handpiece or rotary power tool, such as the Distar dental Dremel with an acrylic burr, or a pair of strong scissors, such as crown and bridge scissors. A small torch to flame finish the thermoplastic, and orange solvent to polish and disinfect can also be helpful. Set the adjustable Therasnore to position number 1. To do this, first line up the tracks or snap-together points. This can be most easily seen from the back of the appliance. Now, looking at the side of the appliance, line up the pointer on the lower tray with the number 1 on the top tray and snap the 2 trays together. Never attempt to slide the 2 pieces together, as this can result in damage to the locking system. Because a microwave oven is the easiest way to heat the appliance and to thoroughly soften the lining material, we will demonstrate that method. First, put about 1/2 to 2/3 of a cup of water in a ceramic mug. Next, drop the adjustable Therasnore into the mug and place it in the oven. Microwave on high for 2 to 3 minutes. This time will vary according to the amperage of your oven. Leave the appliance in the mug when taking it to the chair side. If you do not have a microwave, the adjustable Therasnore can be heated for 2 to 4 minutes in boiling or near boiling water. A small coffee pot or hot water bath may be used. In either case, when ready, the lining of the appliance will be translucent and very pliable. After it is heated, remove the appliance from the water and allow it to cool for about 15 to 30 seconds, or until comfortable to the touch. On the upper portion of the adjustable Therasnore, trench the soft lining where the maxillary teeth will be indenting. This ensures that the lining is soft throughout. If the lining is not completely soft, reheat for an additional 30 to 60 seconds. Have the patient practice biting in a normal, centric position. When fitted, the adjustable Therasnore will initially maintain the jaw in a normal centric arc. As you are fitting the patient, keep in mind the appliance is very warm. Test the appliance for excessive heat before fitting, and leave in the patient's mouth no longer than necessary. While standing behind the patient, align the upper tray over the upper anterior teeth so that the appliance is centered in the mouth. The arrow in the center front marks the midline of the appliance. Gently force the maxillary teeth into the soft plastic material. Help the patient move her jaw so that the triangle of softened material on the lower portion is positioned behind the lower anteriors. Now, have the patient close into the lower tray of the appliance in a normal centric arc. Ask the patient to bite down very firmly until both the upper and lower teeth are hitting the hard surface of the appliance. This will ensure the teeth are seated into the appliance as deeply as possible. It is important to seat as much of the material lingual to the lower anterior teeth as possible. Mold the excess front lining material of the upper portion against the front teeth and gums. This will help with retention of the appliance. Quickly check to make sure the appliance is fit correctly. Is it centered? Are the upper teeth seated as deeply as possible? Is the mandible seated correctly? Confirm the hard material is not pressing into the floor of the patient's mouth. Carefully remove the appliance and allow to cool. To speed this process up, you may place the appliance in a cup of cold water or under cold running water. While the appliance is cooling, you may want to reset it for a few seconds to be sure it does not distort. After cooling, the lining will firm up, but will remain somewhat compressible. When the adjustable Therasnore appliance has cooled, it may require some shaping or trimming. Remember to brace the hand holding the drill or rotary handpiece against the appliance with your thumb. This will give you more control when using the tool. It is best to leave the appliance snapped together and in one piece when trimming. On the lower tray, trim away the majority of the soft material that extrudes labially. The protrusion or ridge on the lingual side of the lower tray can be trimmed down, but should remain long enough that the mandible cannot drop behind it. On the posterior section of the lower tray, trim the appliance down so that only impressions of the cusp tips are in the appliance. This will offer a resting point for the mandible, but will still allow the mandible to slide laterally at least a few millimeters in each direction. If the patient has complained that the hard material was pressing into the floor of her mouth, you will have to shorten the lower lingual portion of the appliance. Using an acrylic burr or strong scissors, trim off the bottom edge of the lower protrusion and smooth the surface by heating with a butane torch. Place the appliance back in the patient's mouth and ask her to move her jaw laterally. When adjusted properly, the patient should be able to close into the appliance and be able to move laterally in each direction. This will help eliminate muscle soreness, which may result from locking the mandible in any one position. If the lower tray does not allow for lateral freedom, use an acrylic burr to reduce any areas that restrict this movement, such as any deep impression of the mandibular teeth. If the patient does have lateral freedom, ask her to move her jaw from side to side. Ask her if she can feel the appliance rubbing on the gingival tissue behind the lower anterior teeth. If this is the case, use the acrylic burr to remove any spots that are rubbing. If the appliance is too tight on the upper teeth, you can reheat the appliance for 30 to 45 seconds. Reseat the appliance with the patient biting into it. Then, with the patient's mouth open, slide the appliance up and down on the maxillary teeth. This will relieve the tightness on the upper teeth. Pull the appliance apart and trim away any of the thermoplastic that may have extruded through the molding holes. Snap the appliance back together. If necessary, any rough areas on the soft material of the appliance can be smoothed out by lightly flaming them with a butane torch. If you do not have a torch, you can smooth out these areas by submerging the appliance in the hot water for only 5 to 10 seconds. For a high gloss finish, and to ensure the appliance is disinfected, polish the surface with orange solvent using a 2x2 gauze square and rinse thoroughly. The adjustable Therasnore should now be ready to use. After fitting the adjustable Therasnore, it is important to give the patient verbal instructions on the use of the appliance, as well as what she can expect to happen while adapting to it. If the patient experiences any discomfort while wearing the appliance, it should be removed immediately, and the doctor should be contacted. This is the single most important point you should make with your patient. The adjustable Therasnore should be effective the first night it is worn, though it will take a few nights for the patient to fully adapt to wearing it. While adapting to the adjustable Therasnore, it is not uncommon for patients to experience excess salivation during the night. This is normal and will improve with time. As with most appliances, the patient will tend to unconsciously take the appliance out of her mouth during the night. As she adapts to wearing the appliance, she will be able to sleep with the appliance longer each night. This typically takes about a week. The adjustable Therasnore should be rinsed each morning in cool water. A soft toothbrush should be used to gently clean the appliance as needed. Soaking the appliance in OrthoFresh may be done twice a week or as needed to keep the appliance clean and fresh. But be sure the patient uses only cool water, never warm or hot. Make sure the appliance is comfortable and effective. If this is the case, there should be no adjustments needed at this time. If the adjustable Therasnore has not stopped or adequately reduced the snoring, the patient will need to have the mandible advanced slightly. To do this, separate the upper and lower trays and reconnect them at the next highest number. At this time, and if you deem it appropriate, you may give the patient instructions on how to reset the appliance either forward to increase its effectiveness or backwards to relieve soreness or muscle strain. Should the appliance need to be refitted or adjusted, it may be reheated for 45 to 60 seconds, an additional 2 or 3 times, before the soft material degrades and becomes unworkable. If the adjustable Therasnore is causing muscular or TMJ discomfort, first make sure that the lower tray is allowing for lateral movement. Anything that unnecessarily restricts either lateral or vertical movement of the jaw can cause strain on the muscles. If the lower jaw does not have adequate lateral movement, use an acrylic burr to relieve any impressions of the lower teeth in the bottom tray, as well as to trim the sides of the protrusion in order to narrow it. A report of pain in the TMJ frequently indicates that the jaw is being held too far protrusive. If this is the case, simply move the mandible into a more centric position by separating the trays and moving the appliance to the next lower number. Usually, one incremental movement should be all that is necessary to correct any discomfort. The patient may experience some mandibular repositioning in the mornings during the adjustment period. If, however, this is still occurring after the first week to week and a half, it is usually because the appliance is not allowing enough lateral movement of the mandible. Make sure there are no deep impressions of the lower teeth that would restrict lateral movement. If this adjustment does not solve the problem, the jaw may be being held too far protrusive. You can move the jaw back 1.5 millimeters by separating the trays and moving the appliance into the next lower number. If the adjustable Therasnore appliance is slipping in the mouth, make sure the upper teeth are fit as deeply as possible in the upper tray. If necessary, reheat and refit the appliance. Border molding the excess material on the upper portion against the gums will help add retention. If necessary, additional reline material may be added to the upper tray and border molded farther up on the teeth and gums. Should the adjustable Therasnore need to be advanced significantly, additional material may be added to the anterior portion of the lower tray. The reline material is supplied in the form of pellets. Usually, 2 or 3 tablespoons are ample for adding material to an adjustable Therasnore. The quickest and easiest way to heat the reline material is in a microwave oven. Place 2 or 3 tablespoons of the pellets in a ceramic mug. Use a mug you are willing to use exclusively for the reline material. Do not add water. Heat in the microwave on high for 5 to 7 minutes, or until the pellets melt into a mass the consistency of thick molasses. Don't worry if a few bubbles form in the material. Overheating, however, may discolor and degrade the performance of the reline. If you do not have a microwave oven, prepare the reline material by placing 2 or 3 tablespoons of pellets in the top of a double boiler. Heat for 15 to 20 minutes or until the consistency of thick molasses. At this point, the reline material is extremely hot. Do not wear gloves, as they will only transfer heat to your fingers. Always work next to cold running water or a container of cold water. Gather a quantity of reline on the end of a small spatula or a tablespoon. Carefully transfer this material to the adjustable Therasnore, adding it where needed. The hot reline will easily adhere to the thermoplastic material, and if you need more, you can easily add more. Dampen your fingers, then mold the material into whatever form is needed. By remoistening your fingers every few seconds, you should be able to safely work with the hot reline without burning yourself. If properly maintained, and if the patient is not a heavy bruxer, the adjustable Therasnore should last 18 to 24 months. At that time, it will have to be replaced. If you run into a problem we haven't covered here or in our reference manual, please feel free to call us for technical assistance at 800-477-6673.